Hello and welcome to Better Living, where we take a holistic approach on what it means to live better. We talk about the intersections of our physical, social, emotional, and spiritual domains, and how a healthy awareness of each one can strengthen our joys and reduce the negative impact of our sorrows. I'm Dr. Neil Ritchie, and it's my pleasure to be your host for this weekly podcast. Thank you for joining in for this week's discussion. And welcome to the podcast. I am Dr. Neil Ritchie, your host for this episode and each and every episode. And I'm just delighted to have you along for the ride this week. It is Mental Health Awareness Month, and so we're talking about some of the mental health related issues that we struggle with to try and create greater awareness, reduce the stigma, and to provide some thoughts about how we might treat some of our mental health related challenges. And so as we do that, hopefully we discover ways that we can live better. Well, this week we want to talk about the challenge of anxiety. Most of us have been there. We have experienced a situation where we maybe panic, maybe we have anxiety, and anxiety is a part of life. Panic is a part of life. And I'm not talking about the overwhelming, the all-consuming kind where we're living with it more days than not for weeks, months, maybe even years at a time. Imagine that you are on a safari. I like to go to Africa. I've been several times. I'm going back pretty soon. And when I go to Africa, I enjoy going on safari. It's not an extended safari. It's usually just a day or two. But imagine that we're in Tanzania, East Africa. We're going on a safari. Maybe we're going to the Ngorongoro crater. And when you go on a safari like that, where there are wild animals in that habitat, you're warned not to step outside of your safari vehicle, because if you do, well, you're really taking your life into your hands, as the saying goes. But you don't listen to the advice. You get out of the vehicle, you begin to wander about. Well, as you're wandering about, you see a lion lurking in the tall grass. What do? Well, I suppose you do what most of us would do, and that is you either freeze, you flee, or you get ready to fight. And I got to tell you, if you fight a lion, you're going to lose. So you're probably not going to fight, but you're either going to flee or you're going to freeze. Well, in that moment where you're experiencing that fight, flight, freeze response, you are dealing with the anticipation of a future threat. We call that experiencing anxiety. Now imagine if you were to experience this fight, flight, and freeze response more days than not for a period of months. If you do, then you might just have an anxiety disorder. To understand disorders, it's helpful, at least I think, to take a history. If you were to go and see a professional counselor or psychotherapist in their practice, one of the things that they're going to do is they're going to take a clinical history. And in taking a history of anxiety disorder, those dealing with anxiety disorder, what you discover is that there are endogenous and exogenous factors. That's kind of a fancy way of saying internal and external factors of anxiety. That's sort of the etiology of the disorder. So let's think about some internal factors of anxiety. The first internal factor is, and when I say internal factor, I'm talking about genetics. I'm talking about biology, how they contribute to anxiety, right? So one of the internal factors is that it's linked to an abnormal regulation of neurotransmitters like serotonin, GABA, you may have heard of that, gamma-aminobutyric acid, glutamate are three particular neurotransmitters that, when not properly regulated within the brain, can contribute to anxiety. Now, what a neurotransmitter does, just a very brief neuroanatomy lesson, a neurotransmitter is how neurons communicate with one another, right? And sending signals throughout the body. Well, that is one of the endogenous or internal factors that contributes to anxiety. Physical conditions that can cause anxiety are things like maybe a tumor, like an adrenal tumor. It could be a cardiovascular issue, could be chronic sinus issues that can contribute to anxiety. Mitral valve prolapse, cardiac issue that can contribute to anxiety. Cushing's disease, delirium, various thyroid-related diseases can contribute to anxiety. Premenstrual syndrome can contribute to anxiety. Various seizure disorders can contribute to anxiety. Those are just a few of the things, the internal or the endogenous factors that can contribute to an anxiety disorder. Well, there are also external factors or exogenous factors, and those are things like social and environmental things, substances, whether we're talking about legal substances or illegal substances, they can produce or even worsen anxiety. I'm thinking specifically about amphetamines and other stimulants. I think about some diet medications, appetite suppressants. There are asthma medications, there are decongestants can also contribute to anxiety. Caffeine certainly can, some steroids, as well as a host of other drugs. So these are some of the external factors that can contribute to anxiety. Well, if you were to go to a clinician and a history is taken, one of the things that a clinician is going to do is they're going to try to understand your symptoms. What are you experiencing? What makes you think that you are dealing with an anxiety disorder? Well, symptoms really vary among people. In fact, I went on the Mayo Clinic website to take a look at the symptoms that they listed in comparison with the Diagnostic Statistical Manual of Mental Health Related Disorders. And what the Mayo Clinic said was that anxiety is, a symptom of anxiety is feeling nervous, feeling restless, or feeling tense. It's having a sense of impending danger, panic. The heart rate goes up. There's rapid breathing, there's sweating, there's trembling, there's the feeling of weakness or tiredness, there's trouble sleeping, there are gastrointestinal issues, there's difficulty controlling worry, there is an urge to avoid things that trigger anxiety, there's trouble concentrating or thinking about anything other than the worry itself. There are other symptoms, of course, that we could add to that. Feelings of depersonalization would be one. Agitation, hot flashes could be one. Frequent urination, dizziness. These are all potential symptoms for anxiety-related disorders. Now, you heard me mention the Diagnostic Statistical Manual of Mental Health Disorders, or the DSM-5. If you were to go to the DSM-5, you'd see that there are a number of diagnosable anxiety disorders according to the DSM. For instance, there's separation anxiety, and what separation anxiety is, it's just an excessive anxiety about separation from an attachment figure. That's all that it means. There's selective mutism, which selective mutism is a continual failure to speak in a social situation. And there's there's social anxiety, of course, that's sort of connected, and all of these can be interconnected. But there's the social anxiety piece, which is extreme anxiety in social situations where it's not possible to avoid people. And there's this constant fear of being scrutinized. So that's social anxiety. There's panic disorder. That is one of the diagnosable anxiety disorders. That's just unexpected and recurring panic attacks. There's agoraphobia. This is an extreme anxiety about at least two specific situations. It may be enclosed spaces. That's a pretty common one. Uh, it could be about being in crowds, being on public transit, being in open spaces. And so it's having a couple of those. That would be agoraphobia. And then, of course, there's generalized anxiety disorder, or GAD. Generalized anxiety disorder is just extreme anxiety occurring for more days than not, for 6 months or more, for a variety of different events. I think it's also important to note that anxiety disorder is no respecter of persons, right? It doesn't matter. Uh, it doesn't matter who you are. You can certainly experience anxiety disorder. The onset of anxiety can begin in childhood. It usually follows specific diagnostic criteria. Um, Such as anxiety or worry is going to occur most days for at least 6 months. It's almost impossible to control. It's usually associated with at least three of the those symptoms that I was mentioning a minute ago that Mayo Clinic had put out. Um, it also is going to cause clinically significant impairment in life's events, whether it be at home, at school, the job, etc. So if you're experiencing some of these things, then you certainly would want to talk to a mental health professional. Well, how do you treat it? How do we live better when we're experiencing a disorder like anxiety related disorders? Well, certainly a treatment approach would be psychotherapy. It may also include medication. Now, I realize that sometimes folks are hesitant to put medicine in their body, especially if it's a medicine that, in their minds, changes the dynamics of their thinking. So, what I would suggest is being educated by a medical provider, uh, or a healthcare provider, which would include your professional counselor. Not that a professional counselor is a medical doctor, but a professional counselor has some training in psychotropic meds and can at least educate you to some degree on uh, the interaction of medication on and with the brain. So it certainly can be a part of the treatment method. Uh, uh, though I realize the hesitancy, but sometimes it's very efficacious when you have both of those items uh, as part of the treatment method for anxiety. Well, there are a number of modalities. When we talk about therapy, there are a number of modalities that have proven helpful for dealing with anxiety. I think about group therapy, that's helpful. So certainly individual sessions. Family sessions can be helpful because sometimes there's one member of the family that's struggling with anxiety, but it affects other members of the family, and the other members of the family have no idea what to do. And so bringing the family together for some family sessions can certainly be helpful. Um, I mentioned the medication. Medication really, when you think about treatment and medication should really correspond to the type and the severity of the anxiety. There's an evidence-based therapy that has proven to be successful in treating people with clinical anxiety, in sometimes in conjunction with and sometimes solely by itself, and that's called cognitive behavioral therapy. And cognitive behavioral therapy would be engaged in individual sessions. But in addition to that psychotherapy, when you do bring in the medication piece, sometimes the medication that is included would be antidepressants like selective serotonin reuptake inhibitors. We commonly call those SSRIs. There are also medications called serotonin and norepinephrine reuptake inhibitors. These are SNRIs. Examples of these are things like Cymbalta. You see commercials about Cymbalta. There's Lexapro, there's Effexor, there's Paxil. So these are some of the medications that could be used, antidepressants that could be used in treating anxiety. There's also benzodiazepines. These are sedatives that are used to relieve acute anxiety, but really they're used on a short-term basis, okay? But I think as we just wrap up here, treatment for anxiety is a process, okay? Staying with short-term treatment methods may not necessarily yield long-term results. So it's a process. You have to kind of stay with it. Medication is sometimes necessary to regulate the brain so that psychotherapy is more effective. And what I like how I like to illustrate that, you may have heard me illustrate it this way before. When we have become anxious over a period of time due to the fact that our brain has a quality called neuroplasticity, meaning that it can be shaped. Over a period of time, we have shaped our brain to become an anxious brain. And what we want to do is we want to reshape, or we want to rewire our brain so that our brain is no longer an anxious brain. It doesn't mean that anxiety goes away, but it just is no longer an anxious brain, if you will. Well, sometimes it's difficult with talk therapy to rewire that brain if that brain has been wired for such a long period of time to be anxious. And so what we can do is we can recommend seeing a primary care physician or a psychiatrist or a psychiatric nurse practitioner who can prescribe medication that will help bring the brain to the table, so to speak, regulate the brain so that psychotherapy can be more effective. Now, there are other things that can be done, of course. Diet is important. Exercise is super important. Avoiding drugs and alcohol, those things are important. Maybe reducing the level of caffeine that we put into our body. Those things can be of help. But whatever you do, be sure to work with your therapist and your physician to develop the best treatment plan for you. And this is one thing that you can do to help yourself live better when you're struggling with the mental health disorder called anxiety. And again, that's working with your therapist, working with your primary care physician to develop a treatment plan best for you. Well, that's it for today. I hope it's been of benefit. Again, we're trying to raise awareness. We are trying to reduce the stigma. We all have things in our life that we struggle with. Maybe yours is a mental health challenge. Don't let the challenge control you. Seek help. And as always, I'm Dr. Neil Ritchie, thanking you for joining us and grateful that you took the time out of your day to learn how to live better. Thank you for tuning in to this week's podcast. If you have questions or comments, please let us know. We'd like to hear from you. If you enjoy our podcast, please subscribe and you'll be notified of new content. You may also like to join our Facebook and Instagram pages. This week's podcast was brought to you by Better Living and Counseling Services. Better Living and Counseling Services collaborates with their clients to establish goals and identify solutions to help clients toward achieving greater life satisfaction. Better Living and Counseling Services is a telehealth practice providing counseling to Georgia residents. To learn more about Better Living and Counseling Services, visit them on the web at betterlivingandcounselingservices.com. As always, we want to remind you that the Better Living podcast is not a replacement for the counseling services of a licensed professional. Please join us next week as we learn to live better.